Welcome to the Bedrock Way podcast, where we're changing the habits of yesterday by creating the new healthcare reality of tomorrow. And today, Jonathan, I have one of my most incredible guests yet, the one and only Dr. Tessa Campbell. Today, I want to talk about how we have become the agents of change, how we have become unrealistic dreamers, unrealistic in the expectations of what physical therapy not necessarily has been, but what it should be, and how we've created that change with the inception of Patient Care Therapy Group. And Tessa Campbell has been an incredible agent of change, riding that bus and making sure that we change the way that we do things, especially in physical therapy. And today, I wanted to talk about, what's in the future for physical therapy, a profession that's pretty much been idle, a spectator, and now has gotten the chance to be on stage and be the protagonist of the future of healthcare. No longer being an extra, no longer being an option, no longer being what we call a non-essential piece of healthcare, but probably being the most essential part of the healthcare continuum, being that we treat a population where lower extremity weakness continues to be the number one risk factor why they're hospitalized, why they fall, why they move to long-term care, and really why they decline. So it is a pleasure for me to introduce my friend, my colleague, somebody, again, who is very, very, very special and a complete catalyst behind Bedrock Healthcare at Home. Dr. Tessa Campbell, welcome to the Bedrock Way podcast.
Thank you very much.
So I wanted to start off with Tessa's bio, which is very familiar to me, this bio. Tessa was born and raised in Colorado and grew up with a strong influence and fascination with all outdoor activities. Whether she was skiing, climbing mountains, or camping, her love for the great outdoors would quickly transform into a lifetime passion. Tessa's competitive spirit led her to gymnastics at the age of 8, refining and perfecting her talents into a Division I college career as a proud member of the Boise State University gymnastics team. After suffering knee injuries, Tessa became familiar with sports medicine and rehabilitation and graduated cum laude with a bachelor's in health science and earned her clinical doctorate degree in physical therapy from Rockhurst University in Kansas City, Missouri. Am I getting all that right?
Spot on.
Over the past decade, Tessa has worked in various settings, both on the West and East Coast of the country. In 2018, Tessa earned the rigorous and distinguished certification as a lymphatic therapist, and in 2020 became a LANA certified through the Lymphology Association of North America, LANA. Beautiful. Throughout her career, Tessa has shown a dedicated commitment in working with the older adult as she empowers her patients to achieve the highest quality of life. Tessa specializes in helping her patients in the battle against frailty by facilitating the resurgence of functional strength, mobility, and balance. Tessa, and now, to add to your bio, you have recently been promoted to our market expansion specialist. And you're going to be, again, the catalyst and the one to really lead our physical therapy innovation from the front. Today's episode is titled, again, in celebration of Physical Therapy Month. It's Physical Therapy Innovators, Building Businesses and Healing Bodies. Tessa, let's start off with telling me a little bit about yourself, how you came to be a physical therapist, and your background, and what motivated you to go to a career which, again, I will tell you, when you guys hear Tessa's story, this is an individual that could have done anything in the world, anything. And I'm so privileged as her colleague that she chose the physical therapy profession. Talk to me, Tess.
So I started gymnastics at 8, like you had said. It was kind of just a sport I literally asked my parents to go into, and I think they thought it was going to be a couple-month gig, and then I was going to be gone. And 14 years later, and a few injuries later, a few surgeries later, I was still doing it. So with gymnastics, pretty rigorous sport, high injury rate, and I suffered quite a few knee injuries, which put me in physical therapy, and a great deal of it. With that, my physical therapist was also my gymnastics coach. So that was a huge inspiration for me to kind of go into that field. When I injured myself and I was asking her, hey, can I do Tkachevs? Can I do Jaegers? Can I do Yurchenkos? She knew what I was talking about. So, which was nice, because when you ask a physician, about those skills. And if you're allowed to do them after an injury, they kind of give you the bug-eyed look. So that was awesome to have that physical therapist in my world that knew my world. So when I was looking for a career, I had been on the patient side for so long that it just seemed like a perfect fit. I was very comfortable in that world. I had been surrounded by great physical therapists that had put me back in the sport time and time again, and it just seemed like a perfect fit.
That's great. And you talk about something that's so unique. You said you had to do a lot of hours of dedication. I know I have my niece, my 9-year-old niece, Leandra, is a competitive gymnast. And I see the amount of time that you guys dedicate to gymnastics. And I wanted to ask you something because it becomes a very difficult conundrum for me. So it seems like gymnastics, again, a sport that demands so much continuous dedication, and it's something that you have to practice.
Indeed.
Right? And that was the motivation for you to become a physical therapist. But yet, you become a physical therapist, and yet when we take care of our patients, or as you take care of your patients now, you take care of them episodically. You get them strong, and then you have to discharge them. Physical therapy has been erroneously prescribed since inception.
Agreed.
And that's one thing that I'm inspired and I'm assured that since patient care therapy groups started, the legacy, illness-driven aspect episodically of physical therapy ended as well. Talk to me about that, Tessa, because I know that we're like-minded in the fact that we've been, as a physical therapy profession, we have been detrimentally efficient. Mm-hmm. The more our reimbursement is cut, the more we cut our interventions. And the only ones that are suffering are our patients.
Yeah.
Talk to me.
Kind of going back to that gymnastics, like training, right? So it's 30 hours a week for your life, essentially. And even when we would have holidays, we would come back and be off. It's a well-known thing that sometimes injuries happen with 1 week off. And that goes along with just training for life, training for your daily activities. You've got to stay consistent. Consistency is the most important thing. And when we do this episodic treatment of go, stop, it's not an efficient, productive way of getting someone better and keeping them better.
I've always looked at exercise, just like you looked at gymnastics, just like we look at everything, as being a lifestyle change, not a temporary fix. And I think that has been the biggest issue, Tessa, with physical activity, with therapeutic activity, with physical therapy, occupational therapy, any type of intervention in the modern healthcare world. It's supposed to be a temporary fix, right? Which is the allopathic method, take a pill and call me in the morning, right? Is usually the same we used to do. Exercise is different because exercise has to be a permanent, right? A permanent change that your genetic makeup undergoes. And we know through research, overwhelming research, that there's a downregulation of neuromuscular activity that affects the muscle, makes us stronger, hypertrophy. We can get very fancy with Z-bands and talk about sarcomeres and all that stuff here. But the fact of the matter is, we change the body permanently through exercise.
But if you don't use it, you lose it.
Thank you. So how have you in the last year become an agent of change by being able to make sure that, again, you're not a physical therapist here. No one here is. We're all primary care providers. We just happen to be physical therapists. Mm-hmm. So tell me how that change has transcended not only you as a professional, but really the patients.
Yeah. This position has helped me have a wide range of disciplines that I have access to. So I'm not just a physical therapist. I am a pathway to other areas of healthcare, to other disciplines of therapy, to other healthcare aspects. As a physical therapist, I can become a referral source to these other disciplines and these other aspects of healthcare. I also have the most amount of time with my patient to really dig deep and find those weaknesses in their life or those deficits that are existing that maybe no one else has searched or found, that I have that time and that ability to get down to it.
Close to 28% of physical therapists are leaving the profession.
Burnout.
Talk to me about that.
We're in a world that insurance dictates our job, essentially. And we are limited by the amount of time. We are limited by the amount of visits. We are limited by copays. And we are limited by our schedules on getting to all the patients that need to be helped and then having the time to really help them efficiently. That is hard on a physical therapist who knows they can get someone better if they had the time and the availability and the amount of visits that would be needed. That is hard on a physical therapist, and therefore I think they lead to other professions that may be more satisfactory for them.
I want you to describe to the listeners, Tessa, the traditional role of a physical therapist within the healthcare continuum. And then I want you to tell me how that traditional role has changed during the past year as a physical therapist for patient care therapy group, because I know they're not the same. So tell me the traditional role and how you have made sure that that role has changed in providing physical therapy to your patients for the past year and hopefully for the future.
The traditional physical therapy role is we're kind of low on the totem pole, I feel. We are kind of, doctor prescribes it, you get the referral, you get the script, you start your care, you send it back, and then you discharge at the end of the day. In patient care therapy group, we are the leaders. We are some of the first people that go in to see these patients. That's why we got our doctorate degree. That's why we have that extended education to really have those skills to diagnose something or at least feel that it's not a physical therapy treatment that then we refer back to the physician or whatnot. So that's kind of that direct access, that education that we are a leader provider. We are that primary care provider with those patients. We are the first ones to go in and really see the patient as a whole, and then at that point decide sometimes what avenue they might need it in addition to us.
So tell me a day in the life of you as a physical therapist today compared to the past.
Today is a lot more beneficial to my patients. I see major changes, especially when I do progress notes. When I do a progress note on a patient, I'm almost sometimes blown away by some of those statistical changes that I see. I'm like, oh my gosh, you shaved off 12 seconds off of your timed up and go test. And even the patient and I are sometimes blown away. In the past, when I've done physical therapy at a place that has very short amount of time and I'm pressed for treatments and I have a gazillion patients going on at the same time, I do a progress note and not much has changed. And that was also another unsatisfactory point of doing old school physical therapy. You were not seeing the changes. In this job, I see those changes every progress note I do, and it's awesome. It's motivating. I tell the patients about how much changes they've made, all the things that they're doing. I'm having to upgrade goals all the time because they're meeting them all, and it's really fulfilling.
I love it. Oh my goodness. Listening to you chronicle, what you're doing with the patients is essentially what we should be celebrating Physical Therapy Month. PT Month, Physical Therapy Month is not to just say, hey, congrats on what you do, have a good day. It's what can we do better? Which is essentially at the core of being a physical therapist. We identify problems, we develop an intervention plan to address those problems, we provide progress to make sure that people are getting better, and we prognosticate a goal that should be achieved if we follow that plan. But yet our profession hasn't followed that plan. Our profession has seen us, again, get cut and cut and cut and cut and cut through the years, through the Medicare cap, through sequestration, through MPPR, the multiple procedure reduction, and yet again, we face another cut this upcoming year. Let's talk about the business of physical therapy, because that's one that I know you have a little bit of experience in. You had your own practice in Nevada before coming on board with us. And the business is something that to me is I love it. I love the business of physical therapy because when you do it right, my goodness, you do well. As someone who, again, has been in the field for over a decade, has seen the good and the bad and the ugly, what, in your opinion, awaits the physical therapy profession short-term and long-term? How do you see it, Tessa?
I think we are such a valuable product in the healthcare field that we need to market ourselves as such, that we need to almost kind of combat those insurance companies that continue to give us cuts and show why we are so valuable.
I think we need an identity crisis facelift. I think we need a renovation. I think we need to go to one of those fancy surgeons and really provide us a facelift. You said it earlier. We're low on the totem pole, but yet we're one of the most necessary aspects of the healthcare continuum. We spend the most time with our patients. We get to know them best. We're clinically trained to be able to identify all of the disease processes that are going to be able to, if something's not within our scope of practice, we're trained to be able to refer.
And yet our reimbursements continue to be decreased.
Let's revamp the profession. Because again, I think that will be a really good way to celebrate PT Month. Just like with our plan of cares, where we're looking to enhance the function of our patients and get them to not where they should be or were, right? The whole pre-morbid functional status is not something that works here. We get people to the optimal function, right?
Past even their prior.
Yes, right? Let's get them to a place where they didn't think they could be. Because physical therapy, exercise is powerful. It's powerful, right? So I say the first change that we need to do, Tessa, and I'm going to give you 5 points and I want you to comment on each one.
Okay.
Number one, we need to be a direct access point into the Medicare system. The fact that we are still an incident to referral, right? We need a prescription to justify something that's the number one risk factor for older adult decline. We need to be a direct access to healthcare. And I'll tell you why. Physicians get about 20 minutes in medical school about exercise. And they get about another 15, 20 minutes in medical school about nutrition. So how is it that our profession is in the hands of a prescribing provider who's not educated about what we do? That's the first change we need to make. There's direct access in all 50 states, but Medicare doesn't recognize it as such.
Insurance is still the gatekeeper.
So how do we change that? How do we change for us to be the direct entry point? How do we change that?
Well, we utilize direct access more rather than always having and relying on that physician's prescription. We have direct access. We can utilize it more. We also need to educate people about that more because they still are old school thinking that we have to have a prescription in order to treat. That's not the case anymore. We can go directly in and treat, and that's why they created direct access, because we have the skills to be that primary care provider.
I don't think people understand what direct access is. I don't think people understand that even direct access is something that's available to physical therapy. So I think that's the number one thing that we need to do, really educate. And that education probably needs to start at the academic level, right? The future clinicians need to understand that there's direct access advocacy. Direct access means the removal of the physician referral mandated by state law to access physical therapy services for evaluation and treatment. Every state, the District of Columbia, and the U.S. Virgin Islands allow for evaluation and some form of treatment without physician referral. I guarantee you that a lot of our listeners, the first time they heard about that.
Agreed.
I talk to nurses. I talk to doctors. I talk to dietitians, pharmacists who say, I need a doctor's script. I'm like, no, you don't. No, you don't. And I think that's the first thing that we need to revamp. It's educating our healthcare continuum, our allies, our partners, the team in the healthcare continuum, that physical therapists are trained to be able to be an entry-level aspect to the healthcare continuum. That's number one. Number two is we need to educate people on the right frequency, duration, prescription, dosage of our services. How do we do that?
Use statistics, use the research. There's studies out there that prove how long we need to truly make changes.
this one just makes me go a little crazy, Tessa. There's overwhelming evidence that exercise and physical activity, when given at a correct therapeutic level, is massively effective with virtually no side effects. But there's probably more overwhelming evidence that it's underutilized. Think about that. Think about that dichotomy where something that is so unbelievably helpful yet is not used. So there has to be a massive campaign where we educate people that you need to have the right exercise. You need to have it be given by the right clinician, and you need to be able to, again, achieve that to get the right outcome. Number 3, I'll tell you what the other aspect of it that needs to happen is, and this is probably the toughest one, is the payer must increase our pay.
That is where the true battle lies, I think.
So how do we tackle that?
Approaching those payers with statistical evidence on how those patients need to get better. They need this extended time. And if they give them that time, it is actually cost effective for them. Because if they pay for that patient to have 16 weeks of therapy, their cost of a hospitalization is likely going to decrease. It's going to be a beneficial pay, a beneficial business decision for the payer.
If we're talking about business and we're talking about cost and we're talking about, the silver tsunami, and we're talking about how can we provide value-based healthcare to reduce those costly rehospitalizations, it's essential to have people access physical therapy whenever they want. Having direct access to physical therapy offers significant benefits for those who need care, as it saves time and money.
I've always been a proponent of you go to your doctor for your annual visit. I believe you should go to your physical therapist for an annual visit every year, if not twice a year, to have a full evaluation of strength, mobility, exercise, cardiovascular endurance, and see where your weaknesses are to prevent anything from happening. I would love to be a yearly visit for everybody. I think everybody would benefit from that immensely.
And I think that one of the biggest ways, Tessa, I agree with you 1,000%, is make physical therapy a medical specialty. Mm-hmm. If you make physical therapy a medical specialty, every single medical specialty is paid at a higher reimbursement level than primary care.
Yeah, your annual visit is a good amount of money that you pay your primary care doctor. That should absolutely be a physical therapy appointment as well.
But most people say, well, we shouldn't pay more for physical therapy because people need it more frequently. Yes, people need it more frequently because we have a very illness reactive healthcare system where we need to overcome and almost overcompensate what hasn't been done for years. This is a problem that didn't start yesterday, right? This is a chronic problem. The other thing that we really need to work on, so we talked about the identity crisis, right? So we talked about direct access. We talked about the frequency and duration. We talked about the payer. Number 4 is really academic. There is and this is why it has to become a specialty, because I think we're going to have less and less and less people going into the profession. You know why? Because people are coming out of school with massive debt. Massive debt. I mean, I'm talking physical therapists are coming out with over $200,000 in debt.
I know many of them.
So how do we change that?
I don't know. I don't know if we could talk to schools and be like, this is kind of ridiculous, getting interest rates lower. I really don't know how to tackle that.
And you know what?
Yeah.
I don't think anybody knows that.
Yeah.
But I will tell you, I think that is one of the biggest issues and factors that we have where we're educating. I mean,
they did a mathematical equation of physical therapy school and what you make after school and if it's a worthwhile decision. And the overwhelming answer was no.
Of course.
There's a YouTube video on it.
Of course.
Yeah.
And inflation and the cost of doing business continues to go up, up, up. Right? So if the cost of doing business continues to go up and the reimbursement for our services continues to go down and the value of it continues to go down,
Why would you choose that as a career?
Right? It becomes very, very challenging. So I'll tell you one solution that I have in this aspect is we need to start holding universities accountable for job placement. We need to start holding universities accountable for advocacy efforts, right? Our APTA does a tremendous job at advocating for our profession. But if universities are being given millions, right? Millions in student loan reimbursements and grants, right? I could be an 18, 19-year-old, get into medical school, I should say get into physical therapy school, and be given a $200,000, $300,000 loan. Universities are going to continue to increase tuition.
Prices.
So I think there has to be a concerted effort where universities are going to be held accountable to that job placement.
If they want the profession to continue, they're going to have to make some changes, because right now the overwhelming answer is no, don't go. Choose a different profession.
When I was going to school, I remember somebody telling me, physical therapy, you'll never make any money in physical therapy. And again, as being agents of change, and with this being such a necessary intervention, as we celebrate Physical Therapy Month, we have to celebrate the changes that we need to make. And number 5, I think this is something that, again, is heavily needed. There has to be a clear delineation in the way that we are reimbursed through the fee schedule. And again, not only does the pay need to go up, the reimbursement needs to go up in order to substantiate that academic investment, right? But we also are reimbursed by something called the fee schedule. And the fee schedule reimburses us for time, not service, for time. So what that does, Tessa, is it pretty much tells me that if I spend time with a patient, I get paid, not necessarily if I get them better. So there has to be a value-based way for us to be able to get reimbursed for services. And most other CPT codes within the fee schedule of services reimburse us through the service that's provided, not necessarily the time. Because I do think that there are a lot of our colleagues who are looking at that clock, right?
For sure.
When they're doing their interventions, rather than looking at the patient. Mm-hmm. And I think if we address those 5 things, making sure we educate the field on direct access and the existence of it in the 50 states. Number 2, making sure that the right frequency, duration, and exercise prescription dosage is being adhered to and complied with. 6, 12, 16 weeks. If we challenge the payer and position this as a medical specialty that, actually addresses the number 1 risk factor why you are paying $18,000 for hospitalization. Number 4, we hold our academic institutions accountable for the rising cost of tuition and challenge them to also have stake in the game when it comes to job placement. And number 5, we challenge the reimbursement of the fee schedule to be predicated more on value and service rather than time. I think that would be a really good way for us to revamp the profession. One thing that I wanted to kind of also talk to you about today is really the evolution of your role. You're now the market expansion specialist for Patient Care Therapy Group. And under the tutelage of Bedrock Healthcare at Home, you have the job, I call it the privilege, to be the catalyst of changing physical therapy identity in all of the future states that we occupy. Tell me a little bit about your new role and how that makes you feel in a way that I know you're someone who likes to do things different. You're motivated, you're competitive, and you don't play just to be in a game, you play to win. How are we playing to win as we prepare to really make a national expansion?
Well, we just went into Las Vegas, Nevada last week or 2 weeks ago. And the biggest thing was really knowing the market, learning our business, all the ins and outs, and then setting ourselves apart from everyone else that is already maybe established there. Knowing our competitors and taking that, what they do, and then showing them that we are different, we are better, we do something in a different category or a different level than them.
And how did you do that? So when you guys started in Nevada a couple of weeks ago, tell me the attention and the reception that we have received by being there in the last couple of weeks. I know you're talking to the team that's there, quite a bit.
Yeah. So the Part B kind of in the home, the Medicare Part B provider in the home is a semi-new aspect in Las Vegas. There is a couple people that are doing it. So we were more educating some of these home health companies, assisted living centers on what we do and why it is different from the normal healthcare and physical therapy that they have seen. And then also to set us apart from some of those competitors is bringing the entire ecosystem to Nevada to really show that we have an entire medical group that will streamline these patients' healthcare to make it simpler and put the healthcare back in the patient's hands. They have more control and improved outcomes with that streamlined healthcare.
One question that I wanted to pose to you is that the physical therapists are creatures of, we like consistency, right? Because we know that with consistency, the results come. You have a role that is not going to be, predictable. You have a role that's going to look different in every state, from a reimbursement, from a patient, from a support system. How are you preparing yourself for that business chameleon that you will need to be in the next few months as we roll out all of our new states? And how are you prepared to deal with some of the ways? Because again, there's going to be obstacles. There are going to be mountains. There are going to be setbacks. And what are some of the things that you are preparing for? Or how are you preparing for those things?
So some lessons learned in Las Vegas is really learning the market a little bit better, really kind of educating myself on who the competitors are in that area, what are the patient population, what are the home health companies in that area, who are the major players in that market that we're going to enter. And again, Las Vegas is completely different than Texas, than Florida, than Ohio, than here. And so that's a huge proponent for the next step. And then also learning the Spring Hills communities, learning that type of environment and the patients that reside there and how we could bring our ecosystem and even change the ecosystem a little bit to more benefit each and every building separately.
The title of this podcast, and I'm saying that over and over again because I want my listeners to understand the value of what we're trying to project to our listeners. Physical Therapy Innovators. We want to take the profession to the next level. And we also want to be able to have the comfort in the fact that we are building a business by healing bodies, because that's really what we do. There's one slogan that you live by, and you live by take the risk, book the trip. What does that mean to you?
I feel like my life has come with so many twists and turns that when you get the opportunity to just take it, to go for it, be a yes man, be a yes woman, and roll with the punches. Life has a lot of different variations, and I always feel like when you make a plan, don't be too hard set in it because things change rapidly.
I think, Tessa, that those words and that slogan should be really what pushes our profession to the next level. Because what take the risk, book the trip means to me is push yourself out of the comfort zone. Challenge yourself, right? The phrase is an encouragement of motivational suggestion that you should be more adventurous and not be afraid to step out of your comfort zone. It implies that you should go ahead and make plans for a trip, even if there are uncertainties or risks involved. There are risks involved in us challenging the status quo. There are risks involved in us wanting to change something for the better. But it's often used, that statement, to inspire people to embrace new experiences, explore the world, and not let fear hold them back from traveling or pursuing their dreams. In essence, it encourages you to take a chance and commit to an adventure by booking a journey or a vacation. And I think that, to me, embodies who you are. That embodies, as a result, who we are. And I think it really embodies who the profession should be, right? And as we talk about celebrating physical therapy, what we need to talk about is, how do we take physical therapy to the next level? When you said that in our pre-screening interview, that was so powerful to me. Now, changing gears a little bit about with the profession, I want to talk about your future. And I want to talk, I know, where you see yourself and what is next for Tessa, both professionally and personally. I know you have some big goals. And I know you're again, somebody who likes to book the trip, has big aspirations. So tell me, what is in the future, short-term and long-term, for Dr. Campbell?
Well, again, I'm just kind of getting into this new role, so I am learning a load about the business and taking it to other places. So I'm definitely kind of got my hands full at the moment with this new promotion and, again, growth of the company, which is honestly super exciting. I loved being in Las Vegas and kind of growing into this new aspect of physical therapy. From that, I believe the sky's the limit. I have no idea where we could go with this. I think it could be a huge, huge production nationwide, and I'm kind of along for the ride.
And as we talk about the profession and what changes need to be made, I want you to tell my listeners, what would you tell a young 18-year-old who's going to school, who is like a Tessa, who may have a athletic background, who may have been exposed to physical therapy and wants to be a physical therapist? Tell me two things that you would tell that 18-year-old promising physical therapist if you would have the opportunity to talk to them today.
I would say be really open to any sort of opportunities that come your way. For instance, I moved to New Jersey, that I did not see that as a plan in my life. And then this job kind of fell into my lap and had to roll with it. And it was awesome. Another thing that fell into my lap was becoming a lymphedema certified therapist. That is not something I ever saw myself doing. And the doors were opened for that. And I took it. And it was actually a really wonderful aspect of healthcare that I had no plans to go into that type of a field. And it's a specialty that, kind of sets me aside. So I would say be open to opportunities, open to doors. If the door shuts, a window is opened or something like that. Yeah, that's where I would tell a new physical therapist going into school to just be open to whatever life kind of, the road that it goes, because it's not always the one that you've planned.
And what would you tell that 18-year-old Tessa if you had the opportunity to go back and talk to her?
Get ready. Put your seatbelt on.
Do you think that the 18-year-old Tessa would be proud of the Tessa of today?
100%.
That's awesome.
Yeah.
Let me ask you something else. If you had chosen something else other than physical therapy, what would it be?
I definitely was debating between physician's assistant. I definitely wanted to be in healthcare. However, before all of this, I was thinking of going into broadcasting. And here I am, nervous as hell on this microphone, so I'm glad I chose physical therapy.
Really?
Yeah.
I did not know that about you.
That was a long time ago, but there was a moment there that I really thought I could do it.
Oh my goodness, I love that. Outside of physical therapy, and again, which pretty much right now is your world, right? Both in your promotion, the last year, really growing this and really almost paving a new path for the future clinician. right? So you've done a lot of innovation. You're very involved in the business decisions that we do here behind the scenes in running the practice like we do. But at home, let's talk about what motivates. I've always said, I go back to my chemistry days, Tessa, and there's a term called an enantiomer. Remember that term? An enantiomer is a mirror image, right? It's a molecule. I think so. My chemistry people don't quote me, but it's molecules that look like mirror images, enantiomers. And I've always told people, anyone who's good at work is good at home. There's no one that is good at work and a train wreck at home and vice versa. And I know you happen to have an incredible support system, both at home, and I know your parents are very much involved in what you do. Your mom's always been a big champion of you on social media, which makes my heart really, really big and happy. So tell us about your support system and tell us what makes Tessa have this infectious personality and this infectious enthusiasm, which is pretty much on your face and your aura 24/7.
I bring it back to that support system. They are my rock. My family and my boyfriend are some of the most amazing people and that have my back at all times. So if I fail, I'm never too far because I know they're my rock. They got my back. So that's why I think I can take those risks and take that jump because I have the rock of a support system of family. I also have friends that have become family. I've moved and lived in a lot of places, and I have grown to have some amazing friendships that have lasted for many years. We are very distant in in space, and yet maintaining that friendship and that support system miles apart.
I was trying to research a couple of things, and one thing that I was trying to research is the future of the profession. And physical therapy is in the top five of growing physical therapy professions. But it's also in the top 5 of people leaving the profession. So that is a very contradicting, situation. So what can we do right now? Because again, if we're going to change the identity of our profession, if we're going to kind of pave and continue to pave a new path for the future generation of physical therapists, what do we tell our profession right now? What can we do to make sure that we say, hey, hold on. You might have that desire to leave, but the best days are yet ahead of us. How do we do that, Tessa? How do we educate the young minds to make sure that they continue to be resilient and change the game by staying rather than leaving?
So Forbes had released something that said the happiest profession was physical therapy. So I think that is also what keeps me in the profession because every day I do actually enjoy what I do. And I can't say that there's many professions that can honestly say that. So that is what keeps me here. I truly enjoy working with patients. I truly enjoy getting them better and doing it with a natural treatment, not a pill, not a cream, nothing. It's hard work. It's just hard work to get these patients better, and they've got to be dedicated to it.
I go back to the statement that I said earlier. When you're giving someone a sense of purpose, when you're making a true difference in people's lives, and you're helping not only the patient, but their families, I don't think there's a profession that has a more fulfilling, aspect than the one that we have, and it's something that I'm very proud of. I will give you an incredible compliment, and that's one that every single time that I'm around you, I almost know for certainty that I am around someone who's great. I got to give you a tremendous compliment in the fact that you have this unique optimism, you have this unique courage where I know that no matter what I put on your hands, on your shoulders, and I task you with initiative-wise, you're not only going to do it to conclusion, but you're going to do it in the best outcome possible. And you're someone who I've learned to trust. You're someone who I've learned to really observe. You inspire me a ton because I love how much you've grown in the last year. And if our listeners knew the story behind how you came into patient care therapy, that would be pretty funny, which was like a 5-minute interview as I was taking off on a flight, right? I was taking that risk on a flight, and I'm so happy that, again, in the last year, you've been part of us. I think, you're someone who makes every day here a lot more enjoyable, but really you're someone who makes the profession different. You're someone who really enhances the value of what we're trying to do here. And you're someone who I think, and I know, is going to leave the profession much better than you entered it. And I think for that, I get tremendous pride to have you be part of our team. And Tessa, this is only the beginning.
Thank you.
It's only the beginning. And I think we're in the beginning stages of writing, Dr. Tessa Campbell's book, which I think the ending is going to be incredible, just like the beginning.
If it's anything like the first decade, I'm excited for the next.
I love it. And we are changing the habits of yesterday by creating the new healthcare reality of tomorrow. Thank you so much, Tessa. It was a pleasure.
Same here. Thank you.